Today I have a question from an NDI support coordinator who asks, is deep suctioning the skill of a critical care registered nurse? My name is Patrick Hutzel from intensivecareathome.com. This is the question I'm going to answer today. So when NDI support coordinators reach out to us and find out what our service can provide, if they want a nursing assessment or an NDIS nursing assessment for our clients, or they simply have clinical questions that they can't really answer for themselves because they're, most of the time not clinicians. One of the questions that they ask quite frequently is whether deep suctioning is the skill of a critical care registered nurse. So what is deep suctioning for that critical care nurses are so specialized on? Well, there's probably 3 forms of deep suctioning, but only 2 are applicable in the community. Number one level of deep suctioning is with the tracheostomy, right? And the second level of deep suctioning that's applicable in the community is simply either through the mouth or through the nose when there's no tracheostomy present. Right, I'll go down into more detail in a minute about that. And the third deep suctioning skill that critical care nurses need to have is in intensive care when they have a ventilated patient with a breathing tube, with an endotracheal tube, but that's not applicable in the community. So, in short, deep suctioning in the community, whether it's with a tracheostomy or whether it's deep suctioning through the nose or through the mouth that's going down into the lungs, is exclusively the skill set of a critical care registered nurse, also known as a CCRN, because CCRNs are trained and certified to care for critically ill patients, including those with artificial airways like tracheostomies or endotracheal tubes, but also deep suctioning includes deep suctioning through the mouth or through the nose. When doing deep suctioning through the nose in particular, it is advisable to use a nasopharyngeal airway, also known as an NPA. When doing deep suctioning through the mouth, it is advisable to use a Guedel airway whenever critical care nurses can do that, because it makes it safer for a patient and also is, generally speaking, less uncomfortable for a patient. So the simple reason why exclusively critical care nurses are trained for deep suctioning is that they are trained in airway management, including deep or closed and open suctioning techniques, monitoring for signs of respiratory distress or hypoxia, using sterile or aseptic technique to prevent infection, assessing secretion characteristics and lung sounds, often what's precluded to a tracheostomy suction or a deep suction is auscultation of the chest with a stethoscope, checking of oxygen levels, right? Sometimes arterial blood gases, and then a deep suctioning is to follow. Deep suctioning, generally speaking, should only be done when clinically indicated, as it can cause complications like hypoxia, trauma, or infection if done improperly or too frequently. So, but that's why it's so important that, especially when it comes to community care, when ventilation, tracheostomy, but even without tracheostomy and ventilation, when deep suctioning is required, which often does need to happen for clients with cerebral palsy, Rett syndrome, sometimes spinal injuries, sometimes acquired brain injury or traumatic brain injuries. That's why it's so important that there's 24/7 critical care nursing cover, because if that's not given, then patients can go back to hospital frequently, or they can even die, And I've extensively spoken about, that patients have died in the community because there was no funding for critical care nurses 24/7 from NDIS or from other funding bodies that have cost people's lives. And that's why I'm making these videos, making sure that vulnerable clients, especially with unstable airways in the community, get intensive care at home treatment and nursing care so that they can live their best quality of life in the community. Now, with intensive care at home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. That means we're providing a genuine alternative to a long-term stay in intensive care for ventilation, and tracheostomy adults and children, home BiPAP, home CPAP ventilation without tracheostomy, tracheostomy without ventilation, home TPN, home IV potassium, home IV magnesium infusions, IV fluids, and IV antibiotics. We're therefore also providing central line, PICC line, Hickman's line, as well as port management at home. We're also providing ventilation weaning at home, as well as cough assist management at home. We're also providing nasogastric tube, PEG tube, and patch tube management at home, as well as palliative care services at home. We are also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, the In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to an emergency department. We're also in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs between $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per day. And we're freeing up the most sought after bed in a hospital, which is the ICU bed. But most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. Of course, quality of life at home is much improved, surrounded by families. With intensive care at home, we're currently operating all around Australia, in all major capital cities, as well as in all regional and rural areas. We're an NDIS-approved service provider all around Australia, TAC and WorkSafe in Victoria, NIISQ in Queensland, as well as the Department of Veteran Affairs all around Australia. Our clients and we as a provider have also received funding through public hospitals, private health funds, as well as departments of health. We are currently the only service provider in Australia that has achieved third-party accreditation for intensive care at home nursing in 2025. We have been achieving this level of accreditation since 2012. No other service provider has achieved this high level of accreditation in the community and has created more intellectual property for intensive care at home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. If you're at home already, or if your family member is at home already and you're watching this, or if you're stuck in an ICU, or your family member is stuck in an ICU, or if you're going to hospital and ED all the time, and you realize that you don't have the right level of support at home or in an ICU, I'll give you a very tangible and real-world example today so that you can understand how we can help you. One of our first clients when we first got started in 2012 was a client who was at home initially on a ventilator with a tracheostomy with the support worker model 24/7. Of course, support workers are not able to look after ventilation and tracheostomy. That is simply dangerous and negligent. Having support workers looking after a client at home on a ventilator with a tracheostomy is like flying the airplane with a cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies 24/7, or even at high risk of dying if they don't have a team of critical care nurses looking after them 24/7. This is actually evidence-based, and it's documented in the mechanical home ventilation guidelines that you can find on our website at intensivecareathome.com. Think about it. In an intensive care unit in a hospital, you would not have support workers looking after a critical care patient on a ventilator with a tracheostomy. So why would anyone in their right mind would do that in a home care environment in the community? So this particular client found out about us eventually, and the ICU that he was more or less living in also knew about us and eventually reached out to us, and we were proving our concept with this client very fast. When we worked with the client, we sent him intensive care nurses 24 hours a day, and he never ever went back into ICU ever again while we worked with him, and we were proving our concept there very fast. We can do the same for you if you're not safe at home, which includes the advocacy for funding that goes along with it. We have always successfully advocated for our clients. Otherwise, we would not be in business. The same is applicable for those stuck in an ICU, similar to what I just mentioned. Or if you're going back to ICU and ED all the time, reach out to us. We can help you with this very fast. We can take you through the right steps, including NDIS or other funding bodies, advocacy. That needs to go hand in hand with it. which is also why we are providing level 2 and level 3 NDI support coordination. We have a team of NDI support coordinators and they have a wealth of knowledge. I've done an interview with Amanda Riches, one of our NDI support coordinators, and I have put a link to an interview with Amanda in the written version of this blog. We're also providing TAC and WorkSafe case management in Victoria. If you are an NDI support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. If you're looking for funding for nursing care for your participants and you don't know how to go about it and what evidence to provide, I encourage you to reach out to us as well. We will help you with the right level of advocacy. We're also providing NDIS specialist nursing assessments done by critical care nurses with a legal nurse consulting background. And if you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic, high-performing team of critical care nurses in the community, we are employing hundreds of years of critical care nursing experience combined in the community. If you're looking for a career change, we're currently hiring for our clients for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, and in Warragul in Victoria. If you have worked in critical care nursing for a minimum of 2 years in ICU, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I have a disclaimer because we are offering a tailor-made solution for our clients, which includes regular staff and regular teams. Our clients, therefore, want the same staff coming over and over again because they are so vulnerable. Our clients are very special. That's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency, reliability, and our clients are looking for consistency and reliability. So please only apply with us if you can give us regular and consistent availabilities for shifts, and if you're really keen on building relationships with us and with our clients. If you are an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it is much more cost-effective than what you're paying for in ICU and ED, and you get the same level of care. If you are a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, home TPN, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US or in the UK and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website or simply send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you think about this video or what you want to see next. Thank you so much for watching. This is Patrick Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.